What if one of the world's most famous roots can not only warm you in winter and help with colds, but also relieve joint pain? Millions of people around the world experience discomfort in their knees, fingers, elbows, and spine every day. Many believe the only solution is painkillers, but research in recent decades has forced scientists to take a fresh look at common ginger. Today, we'll take a detailed look at how ginger works, why it's associated with reducing joint inflammation, what substances make it special, how to use it correctly, and who may be contraindicated. Chapter 1. The 1,000-year history of ginger. Ginger has been used by humanity for over 5,000 years. Its homeland is considered to be Southeast Asia. Even ancient Indian healers used it to treat various inflammatory conditions. In traditional Chinese medicine, ginger was considered a remedy, capable of restoring energy, circulation, and improving blood flow. Interestingly, many ancient recipes for treating joint pain included ginger. Of course, people back then had no knowledge of molecules and biochemistry. However, observations showed that after regularly consuming the root, some patients experienced relief. Chapter 2. Why do joints hurt? To understand ginger's mechanism of action, it's first necessary to understand the causes of pain. A joint is a complex system that includes cartilage, synovial fluid, ligaments, bones, muscles around the joint. When inflammation develops, the body begins to release special substances, prostaglandins, cytokines, leukotrienes. They are what trigger swelling, redness, and pain. With chronic inflammation, this process can continue for years. Chapter 3. What makes ginger special? Ginger's main value lies in its active compounds. These include gingerols, shagals, zingeroni, essential oils, antioxidants. Gingerols are especially important. They give fresh ginger its characteristic spiciness and possess pronounced biological activity. Scientists have discovered that these substances can influence inflammatory processes in the body. Chapter 4. How ginger affects inflammation. During inflammation, the body produces enzymes that increase pain. These include COX-2, 5-log. Many anti-inflammatory drugs work precisely by inhibiting these mechanisms. Interestingly, gingerols can also partially reduce the activity of these pathways. For this reason, some researchers call ginger a natural anti-inflammatory product. It's important to understand. It doesn't replace medically prescribed treatment, but it can be a useful addition to a healthy lifestyle. Chapter 5. Recent research. Numerous scientific studies have been conducted in recent years. Some studies have shown that people with knee osteoarthritis reported pain relief after several weeks of taking ginger extract. Some participants experienced decreased stiffness, improved mobility, decreased discomfort when walking. The effect usually developed gradually. Ginger doesn't act as a strong pain reliever 20 minutes after ingestion. Its effect is due to its gradual impact on inflammatory processes. Chapter 6. Antioxidants and joint protection. Free radicals can damage the body's cells. With chronic inflammation, their numbers increase. Ginger contains antioxidants that help the body fight oxidative stress. This is especially important for joint tissue, which heals relatively slowly. Chapter 7. Why joints become more vulnerable after 40. A number of changes occur with age. Collagen levels decrease. Synovial fluid production decreases. Tissue blood supply deteriorates. Chronic inflammation increases. That's why many people experience their first pain after age 40. Ginger can't stop aging, but it can support normal body function thanks to its bioactive substances. Chapter 8. Ginger and excess weight. There's another unexpected connection. Every extra kilogram increases the stress on the knee joints. If a person is significantly overweight, their joints work almost at an extreme level. Some studies suggest that ginger may slightly improve metabolism and help control appetite. Even modest weight loss can significantly reduce stress on joints. Chapter 9. How to use ginger properly. There are several options. Fresh root, the most popular method. It is added to tea, smoothies, salads, soups, dried powder, convenient for daily use. Extracts contain standardized amounts of active ingredients. They are most often used in scientific research. Chapter 10. How much ginger is typically used. Dosages vary in studies. Commonly used, 1 to 3 grams of dried ginger per day, or an equivalent amount of extract. Increasing the dose does not necessarily lead to better results. Chapter 11. Ginger tea for joints. Simple recipe. 1. Chop 10 to 15 grams of fresh root. 1. Pour hot water over it. 1. Let it steep for 10 minutes. 1. Add lemon, if desired. This drink is especially popular during the cold season. Chapter 12. Who should exercise caution? Despite its many beneficial properties, ginger is not suitable for everyone. Caution is required for people with gallstones, with an acute stomach ulcer, with bleeding disorders, if taking anticoagulants. If you have chronic conditions, it's best to discuss consuming large amounts of ginger with your doctor. Chapter 13. The most common myths. Myth number 1. Ginger restores damaged joints. This is not true. Damaged cartilage does not regrow thanks to ginger alone. Myth number 2. Ginger replaces medications. No, it can be part of a comprehensive approach, but is not a complete replacement for therapy. Myth number 3. The more ginger, the better. Excessive consumption can cause stomach discomfort. Chapter 14. What really helps joints? The best results are usually achieved by combining several factors: weight control, regular physical activity, adequate protein intake, good sleep, quitting smoking, a balanced diet, eating foods with anti-inflammatory properties. Ginger may be one element of this system. Conclusion: ginger is not a miracle cure or a secret recipe for immortality. However, modern research confirms that the gingerols and other active substances it contains can influence the inflammatory processes associated with joint pain. This is why this root has retained its popularity for thousands of years. It has evolved from ancient medicinal treatises to modern scientific laboratories and continues to attract the attention of researchers. Perhaps the power of ginger lies not in its immediate effect, but in its ability to gently support the body day after day, helping people maintain activity, mobility, and quality of life even as they age.